Hi! Welcome to my second video. And this is about, well, myths about diabetes. Before that, my new opener. Watch! I'm not a doctor, but I have been with diabetes for technically 17 years. 17 years, medyo teenager pa ako noon. Medyo masama loob ko kasi bakit naman ako? Admittedly, mahilig ako sa soft drinks noon, pero this is what I understood eventually after being with diabetes for more than 17 years. So first, myth number 1, gagaling ka. Well, sorry to say, unless palitan natin yung pancreas ng type 1 diabetic, hindi siya gagaling. Tulad ng sabi ng doctor ko nga, it's a malfunction of your organ. Parang yung mata mo, tumigil, puso mo, kailangan ayusin. But as of now, wala pa. So si pancreas ang gumagawa ng insulin natin sa katawan. And since sira yung pancreas ko, type 1 diabetic ako. Yung mga, I appreciate it so much yung mga tao nagsasabi na gagaling ka, inumin mo to, try mo to, para gumaling ka. Those, I think, might help. But unless something injects insulin, katulad ng ginagawa ko. So if I don't inject myself with insulin, yun ang nagiging problema. Yun ang nagiging problem. Hindi ako nag-generate ng sarili kong insulin. So I would need to inject myself with insulin. Gaano kadalas? I inject 3 times in a day before meals and 1 time before sleeping. Yung 3 times ko, fast-acting. So, pag in-inject ko siya, diretso sa taba. Pagka sa muscle kasi, bigla siyang mag-e-effect, babagsak, hypoglycemia. In my first video, I talked about understanding your sickness. Understanding your sickness, hypoglycemia. Hypoglycemia, bagsak po yung blood sugar. Anong pakiramdam mo? Yung tulad na sinabi ko nga, parang may mangyayaring masama. Yun lang. Para siyang yung sa pelikula, yung may tumutugtog na nakakatakot, some eerie music, then you go tunnel vision, you go sweaty, you go dizzy, and that's it. Yun ang pag tinamaan na ng hypoglycemia. Hyper, meaning mataas blood sugar mo, iba-iba. Parang ganun, medyo, pero ang madalas dyan, pagka uhawin ako sa gutumin, usually yan, hyper ako. Pag hypo, yun, nanginginig, nahihilo, nanlalamig. So, myth number 1, hindi po gagaling unless palitan ko yung pancreas ko. 2 is, pwede mo bang kainin yan? Panalo to eh. Pagka to, ang kakita nila kakainin ko, sabihin nila, pwede mo bang kainin yan? Diabetic ka. Well, opo. Just to say, hindi po kami bawal sa sugar. Sugar is kailangan ng katawan natin para to function. If you don't have sugar, magko-collapse kami. Yun yung hypoglycemia. Bagsak yung sugar ko. If bagsak sugar ko, I need this right away. Mas effective ang soft drinks or a Zesto, yung Tetra Pak na juice. Bakit? Mataas yung sugar content niya and it brings up sugar. Lagi niyong tatandaan, mas madali magpababa ng blood sugar kasi injectan mo lang ng insulin or inuman mo lang ng gamot rather than magpakas. Which brings me to myth number 3. Myth number 3, ulitin ko, pangatlo is, hindi ko magaling yung sugat namin. Hindi po kami sa Wolverine na may healing factor. Well, I don't think mayroong mga taong ganon. Pero, gumagaling po ang sugat namin. Depende lang yan kung gaano ka hindi mo ka-controlled ang blood sugar mo. Ako, in my own experience, yung sugat ko, kasi we prick our fingers every day. Pricking meaning, tutusukin namin kung ano namin ng dugo, check namin kung gaano kataas yung blood sugar namin, and I do that 3 times a day. Isipin mo, 600 pesos yung 25 na pieces na strips. Kung may gusto mag-sponsor, hi. 600 pesos yung ganyan, 25 pieces. I consumed that in less than 10 days yata. 10, 12 days, 13 days. So, kung isipin mo, kung hindi gumagana yung sugat ko, pag prick ko ng daliri ko, dapat lahat ng daliri ko ngayon ay nagdudugo na. Nagdidrip na yung dugo niya. So, gumagaling po. That brings me to myth number 4. Myth number 4, mapuputol ka ang paa mo at mabubulag ka. Well, technically, nabulag na yung left eye ko due to diabetes. Pero, since 17 years ko na nga siyang kasama, it was a question of when, not if. And lagi namin usapan ng doktor ko. The longer you have the sickness, the higher the probability that it's gonna hit you, and how controlled you have on your sickness or your diabetes. Honestly, hindi maganda yung pagkocontrol ko ng bata ako. Siyempre, in denial. I was young, I wanted to do a lot of things. Parang pakiramdam ko, tapos na ang mundo, wala na. May sakit ako. So, I was in denial, I tried to do everything. But, again, it's not the end of the world. Diba? Hindi katapusan ng mundo. Well, marami akong nakilala na diabetic na hindi naman nabulag. They died old age, but hindi naman nabulag. It was controlled. It's a case-to-case basis. Amputation. Yes, it is not far from the truth, but if you don't control it, if you don't take care of yourself, yes, that is a big probability. Pero hindi siya 100% sure. Hindi siya 100% accurate. So, parang awa niyo na, wag niyo pong takutin, lalo na it is a deep, may emotional baggage na kasama ang diabetes. Meron siyang, they say that diabetes makes your head go haywire, mas prone sa depression and anxiety, which is, I believe, true. Because I am going through the same things, and you don't need, wag nyo na pong dagdagan, parang awa nyo na. Thank you. So, that's myth number 4. And last but not the least, myth number 5. Myth number 5 is yung paborito ko. And again, paulit-ulit ko na rin ito simula ng bata ako. Yun yung linya na kakaasukal mo yan. Lakas mo kasi kumain, mataba ka kasi. Well, diabetes right now is a lifestyle sickness. Yes, it is acquired through bad lifestyle. But that is type 2. Type 1, na katulad ko, is usually namamana. Namamana meaning pinasa. My joke is, I don't know who my father is, and may papamana lang siya, pamana pa sa akin. And yung nangyari is, hindi naman siya dahil I played basketball almost every day. Sa galaan ako. Yes, I was fat. I was really fat. Tapos, I did not have a neck. Pero, it was not basically on my own fault. And wag niyo pong, ano yun yung mga may diabetes, wag niyo sabihan na kasalanan mo yan and all. They're already going through a lot of things. They prick their fingers. They poke themselves with injection. Yung normal na tao, takot sa injection. Yung normal na tao, ayaw na injection. Kami, we do that just to stay alive. So, parang awa nyo na, napagdagdagan. Yun nga yun eh. Hindi kasalanan usually. Some kids, or some really young kids, do have diabetes right now. As early as 6, 5, 3. Ano, sabihin mo, kakadede mo yan. Right? Kakakain mo ng burger, kakakain mo ng processed food. Hindi. It was a genital,